So I'd like to introduce the next speaker, Dr. Leis. She's professor and head of the Department of Community Health and Epidemiology at the University of Saskatchewan. She has training in health psychology, epidemiology, and community health. And she focuses on a wide range of research topics, such as cross-cultural and official linguistic minority health, integrative oncology, and actually that's where we first met, and quality of life and health services utilization. So the presentation title is A Research Journey at the Crossroads of Professional and Volunteer Work. And this came about as we were discussing a few months ago, her presentation and how fascinating her trajectory has been. So welcome, Dr. Leis, and the floor is yours.
Thank you very much. Do you hear me? Is it fine? Okay, perfect. Well, merci beaucoup. Bonjour à tout le monde.
Thank you very much. Hello all.
For this dialogue, McGill. This is fascinating, and I was actually very surprised to be invited and also to talk about my research career. Usually I don't, my trajectory, usually I don't talk about these things very much because I'm really a community-based researcher, and I work with communities, and this is what is the most important for me. So maybe we could share my slides if you don't mind. Yes, thank you. Yes, so the title is what it is: Research Journey at the Crossroads of Professional and Volunteer Work. So next, please. I just want to first kind of recognize that I learn, teach, work, and live on traditional Indigenous territories that in Canada include treaty lands, unceded lands, and Métis homelands. I want to pay my respects to First Nations, Métis, Inuit ancestors, and also to say the University of Saskatchewan is on the homeland of the Métis and Treaty 6 territory. And in my commitment to this place, I value respectful relationships with the people around me, and I strive to live these values in my relationships and activities. Next, please. And this is actually true for all the work I've done, whether in the volunteer life or in my professional life. So, English and French, French and English, Français, Anglais, Anglais, Français. This has been kind of my life, kind of working two languages all the time. So I want to kind of really touch on my professional trajectory in English, my volunteer trajectory in French, donc ma trajectoire de bénévole en français, and at the crossroad, my research program on the health and francophone communities living in minority situations and merging and forging ahead. Next. So when I think of my professional trajectory, when I arrived in Canada, obviously you can hear that I have a tinge of a French accent when I speak English, but I've worked in English for most of my life since I've been in Canada. My dissertation focused on the impact of head and neck cancer patients and rehabilitation process and outcomes. This was kind of a dissertation done in France, in French, but was drawn to cancer and the experience of cancer patients very early on, because my first actually training is a speech language pathologist, and I just heard the presentation before regarding the training of those professionals, and they are hard to find. I was fortunate enough to become a postdoc at the University of Saskatchewan to study the social behavioral needs of cancer patients and their families. And what was actually critical is that early on, I was able to just get a small little grant, which for a Saskatchewan team, which was a research center of the Social Behavioral Cancer Research Network of the Center of Behavioral Research and Program Evaluation, which was based at the University of Waterloo. And this was actually, between 20,000 and 30,000 per year to develop, to build some capacity research there. I was also the co-PI then of the Cancer Control Research Program, funded by the National Cancer Institute of Canada Regional Research Development Program. So I was fortunate at that time where there was several initiatives that came together and allowed me to take some leadership early on. But everything was really focused on cancer. And plus I was fortunate to have to be awarded a research scientist salary award by the National Cancer Institute of Canada. It doesn't exist anymore. It's actually the Canadian Society Research Institute right now. And then I was a co-PI in a study that, so it actually was a research team on cancer in complementary and alternative medicine. And also I was a member of the first Cancer Institute Advisory Board of CIHR from 2001 to 2005. So all these were years where, from 95 to 2005, where just focused on cancer. I met Carmen at that time. We worked, I worked very heavily in cancer. Now, what was I doing in terms of volunteer work? Can you move on? Yes. So I'm just working in education because my children were small. And so we had to, fight for the right to educate our children in French. And I was actually there when the management of the schools by Francophones passed, the law passed in Saskatchewan, and I became the president. What has been actually significant in my life also is when I do something, I do it for a long time. So maybe people are tired of me, but I try to really fulfill the commitment to the end. I was also became president of the Professional Association of Francophone Parents, and I was also president of the local association. Move on, next. And interested enough, there was then an opportunity to kind of get involved in health because my work was in health. I was interested in education and was they were just parallel roads at that point. When there was kind of the l'affaire Montfort, as you probably all remember, or some of you remember, there was then a task force which was established, a consultative committee by the then Federal Minister of Health, Alan Rock. And I was named by my community because my community knew me and knew that I was a professional as what I was named to be part of that advisory committee, which kind of sat for 2000 to 2007. And at that time, this is when la Société Santé en Français a été fondée. In 2002, I was one of the
This is when the Société Santé en Français was founded in 2002.
And then I became obviously not obviously, but I became a member of the Conseil d'administration comme représentante de la Saskatchewan. And then we had to develop all these networks across the country. And I was kind of instrumental with others to create the Réseau Santé en Français de la Saskatchewan. And I was the first president. Meanwhile, I was also, for example, the chair of the consultative committee of l'Institut Français, which is now la Cité Universitaire de l'Université de Regina. Next. So, as you can see, as I was kind of moving in time, I actually became busy with more and more activities that were volunteer, but also had an impact or could be meshed with my career. And so in 2014, I became a member of the advisory board for the research of official language communities in minority situation. The cross-cutting theme, this was CIHR, and this is where I met Jim Carter, who I saw on the screen earlier here. I was also helped organize summer institutes, and in my own shop at university, I got involved in social accountability, and I said, well, if we are a social accountable university, faculty of medicine, we need to reach out to Francophones in minority situations. Next. And so this was one of them. We had the Médecins de Soins de Qualité. We worked with the AFMC to develop some initiatives to reach out to medical students in order to actually increase the workforce. Next. So what was actually really critical at that point and really kind of shift my career is that I was fortunate enough to be awarded with Dr. Louise Bouchard at the University of Ottawa funding for, as you can see the amount here, for 5 years. But what was interesting, it was not a project, it was an infrastructure grant. So it was kind of really based to, the aim was to really build capacity to do research on the francophones in minority situation. Le réseau de recherche interdisciplinaire sur la santé des francophones en contexte minoritaire au Canada. And as you can see, there was, we managed to have maybe 20 plus researchers. A lot of them were young investigators, and some were seniors because, we wanted to have some kind of a legitimacy as well. We involved 8 universities, all the universities of the CNFS, the consortium, and others where we could find people interested. And over the years, we had probably more than 30 students involved as research assistant or receiving scholarship between 2006 and 2011. Next. So here you can see this was le cadre de recherche, l'étude des facteurs socio-environnementaux, culturels, structurels qui influent sur les disparités en matière de santé chez les francophones en situation minoritaire. Ça, c'était la création d'un réseau national, a national network, and then it was really based on the official languages, the minority situation, the determinants of health. And then we kind of focused on the elderly and the young people, and also the, women who are often the sandwich generation. I don't have time to go into detail, but just kind of, you understand that. Next. And so here, what was interesting, so we had this co-PIs, we had several research teams, and we had a lot of partners, and you can see some of them: Statistique Canada, la Fédération des aînés francophones du Canada, le consortium, etc., etc. And this is the key of success. The key of success is to have very fruitful partnerships and actually do a lot of mentorship. Next. And we had some outputs after 5, actually it was 6 years because we had an extra years for knowledge translation. We were able to build capacity for research on Francophone minority situation. I can see that some of the people who were kind of younger investigators at that time are now almost the senior investigators in their universities. Small amount of funding was accessible to design and pilot test study ideas as a way to really have preliminary data that you need when you apply for CIHR grant. We also held a colloquium near Ottawa, just on the other side in Quebec. And we published a supplement, 2 supplements actually. One is here, the santé des populations de langue officielle en situation minoritaire. And it was articles in French and in English and it's. And then also we participated in the Global Health Promotion in 2014, which were some proceedings of the colloquium that was held in 2011. Next. So, merging and forging ahead, what should we do? And one of the activities and research opportunity that arose at that time was Départ Santé Healthy Start. This was actually a research project that was funded by the Public Health Agency of Canada. And really it was an intervention, population health intervention in childcare centers in Saskatchewan and New Brunswick. What was interesting it was a true partnership between the community, le réseau santé en français de la Saskatchewan, and academic people and policymakers. Next. So I just wanted to kind of tell you quickly what is Healthy Start Départ Santé. It was a bilingual 6 to 8 months intervention to increase physical activity and healthy eating among young children attending licensed childcare centers. It was grounded in the ecological model and the population health framework. And it was really providing support to the educators who were then providing healthy eating and more physical activity to children to be active and eat well. And what was interesting, it was bilingual. So we worked with Anglophone childcare center, and we worked with all the Francophone childcare centers in Saskatchewan, and quite a number of them in New Brunswick. Next. So next. So this was just next. You can just click a few times. So this will kind of show you that the community partner, like le réseau, and hired, because the money actually, also what was new, the money went to the réseau. The money never went to the university, or only some portion of it, but the réseau had the full control of the study and the implementation. And so this is what they did. You know, this kind of shows you all the childcare centers that were visited, and you can see all the numbers of children reached and all the educators who were trained. Next. And so this was actually the team, and this was a community team that was kind of full of energy and just kind of went and did the training for healthy start de santé. And next. And then here, these were the people who actually were involved in doing some evaluation of this intervention. You can see people in kinesiology, pharmacy, nutrition, people in epidemiology, and of course, le réseau Santé en Français de Saskatchewan. Next. So we had several phases. This was funding for about 10 years that we got by in different phases. First, it was really to kind of pilot it. Then with the second phase was really the rollout of the population health intervention, and then the evaluation of 61 centers. Next. Oh, sorry, next. Oh, yeah, okay. So really the aim was to do a cluster randomized control design to assess the effectiveness of the Healthy Start de santé in improving physical activity levels, physical literacy, and healthy eating in 3 to 5 years old children attending childcare centers. Next. And this was published, you know, so I'm obviously just kind of give you just highlights. Finally, the main results were published in 2020. So you can see it's a long time. We started in 2012. And then by the time, you know, we went through all these phases, this was kind of published last year. Next. And then we had a phase 3. And the phase 3 was really to look to, for example, instead of doing an in-person training, now we develop an online training, and this actually training, this was also published. We also worked in adapting the intervention to, for example, First Nations and to immigrant populations. We also did a social return on investment and evaluation of the cost benefits of the intervention. This is also published. We also published a realist evaluation to expand the understanding of how and why and for whom it works. So there was a lot of kind of spin-off of this intervention. Next. Today. So today, I'm the president of the board of Société Santé en Français. It seems like it's the same. I'm still involved dans la santé en français partout au Canada. And I just got awarded a new CHR grant to look at the impact of the pandemic on Francophone families in the prairies. And I want to salute the Réseau du Manitoba, de la Saskatchewan, and de l'Alberta, who are the kind of true partners in this venture. So it's just a few highlights, but it just shows that if you have the passion to do something, if you want to work with communities and you believe in that the research that we have to do has to have an impact, that's, you know, just follow your instinct and just go for it. So I have maybe a last slide, I think. Yes, in summary, the field of research on OLMC has gained traction and legitimacy throughout the years. I have to say that when I started to be involved in late 90s, people said, really? really this is a research subject? When, you know, there was a lot of skepticism among my colleagues. And so you have to kind of continue and persevere. It's critical to continue to build research capacity still today by respectful and reciprocal partnerships with Francophone Réseau Santé en Français, and you in Quebec with the Community Health and Social Services Network, patients group, healthcare professionals, communities, policymakers. Support students training students is just kind of so critical to train the next generation. Mentorship. And I found that when you're a mentor, maybe you're not as productive as a researcher, but for me, it was more important to be a mentor and then work with rather than just promoting myself. Teamwork is fun, but I think requires shared values. This is certainly a lesson that is important. And an academic and research career takes time to develop. As you can see, it's kind of almost spans 25 or almost 30 years. Alone, you probably go faster, but in a team, you go much further, as you know. Thank you.
Thank you so much, Anne. This was great. It really shows that when you blend passion, in your case, it was volunteer work with scientific endeavors or professional experience, when the two converge, you end up informing one another and catalyzing those activities. So this is really a great example, which brings me to one of the questions that was in the chat that talks about labor of love or passion and the blending with experience. And the question is, I'm wondering about, this is from Marilyn Kaplow, how challenging it might be to institutionalize all these successful labors of love, given the upcoming clauses of Bill 96. So maybe to keep the decision broad enough, we won't get into the particularities of the bill, but what are some of the decisions that certain groups make that have an effect on what we do, and how do we, how these decisions may have intended and unintended effects, and how do we handle these things from both research point of view, but also from a field work point of view. So best, you know, the conference today is about best practices and exemplary research and evidence-based research. So how do we actually move this with the understanding that there may be some unintended consequences that we need to document? So is someone, Anne, do you want to take this on, or?
Well, I think what is maybe important to do is, you know, build those relationships, because if you're not known as someone that can be trusted, that kind of follow on their commitments, and I'm talking about even my own institution, you know, and in the university, you know, I have to fulfill, you know, I am a professor, I have to fulfill my roles in, you know, teaching, in mentoring students, in getting grants. And so it is important, but the way I do it, you know, is, you know, for me, is actually working with communities. And so the working with communities and trying to kind of do research that has an impact, or that is meaningful, is very important. And so in our institution, and I don't know exactly how it is in Quebec, it was really important to demonstrate that community engagement is actually a very worthy research. It's not only lab research, it's not only investigator-driven research, but research is, this kind of research makes a big difference in communities or in populations, and for, in this case, for Francophones in minority situation, I would say the same thing for Anglophones in Quebec. And so this has been a long journey, because I don't think it was recognized, you know, maybe 25 years ago, but today it is certainly much more acceptable, also because of the pressure maybe of other populations, such as the indigenous population, which said, do nothing about me without me. And I think it's the same for Anglophones in Quebec. It's the same for Francophones in Quebec. So for Francophone outside Quebec. So that's actually a key. And if we have the population or the community behind, and they feel this is important, you know, who are we as academics to say that it's not worth it? So.
Thank you very much. So any other questions in the chat? I'm not seeing any. So thank you.
We're actually on time.
Oh, okay.
Oh no, I just said that we're actually
yes, we're on
running on time, so it's perfect.
Perfect.
Yeah.
Thank you.
Yeah, no, and I know that it's hard to ask questions in a kind of very brief overview. I hope it kind of resonates. Something resonates with the people who hear, and or there are a message that maybe you can just kind of take or apply to your own lives. So that's it. But
yes.
Thank you for the invitation. I know it's a bit different presentation, but
well, I think what you really showed clearly and with data was that blending led to a very productive career and output that makes a difference in people's lives. Mm-hmm. So I think it's inspiring, and it's also suggesting that many of us, when we do blend these two together, lead to very, I would say, evidence-based, but also very poignant and real-life questions that are being addressed. So I think, and comments are that this was very inspiring. So thank you again.
Yeah.
And
merci de m'avoir invité, puis bonne continuation.
Thank you for inviting me, and have a great continuation of the conference. Thank you.